Download this code from codegive.com, link in the description below. OK, let's dive deep into the topic of breathing difficulties, also known as dyspnea. We'll cover the physiological background, common causes, diagnosis, management, and how you can potentially simulate or model some aspects of breathing difficulties programmatically, though remember, this is for educational purposes and should never be used for actual medical diagnosis or treatment. Understanding normal breathing, the foundation. Before we can understand breathing difficulties, we need a grasp of normal respiratory physiology. The respiratory system's anatomy. Upper airways. Nose, nasal passages, pharynx, larynx. These warm, humidify, and filter inhaled air. Lower airways. Trachea, bronchi, bronchioles, alveoli. The bronchi progressively divide into smaller airways, leading to the alveoli. Alveoli. Tiny air sacs where gas exchange, oxygen in, carbon dioxide out, takes place with the blood. Lungs. The primary organs of respiration, containing the airways and alveoli. Pleura. A membrane surrounding the lungs, creating a potential space with fluid that allows the lungs to expand and contract smoothly. Diaphragm. A large, dome-shaped muscle located at the base of the chest cavity. It's the primary muscle of inspiration, breathing in. Intercostal muscles. Muscles between the ribs that assist in breathing, especially during more forceful breathing. The physiology of breathing. Inspiration, breathing in the diaphragm contracts and moves downward, increasing the volume of the chest cavity. The intercostal muscles also contract, raising the rib cage. This expansion lowers the pressure inside the lungs, becomes negative relative to atmospheric pressure, causing air to rush in. Expiration, breathing out. In quiet breathing, expiration is largely passive. The diaphragm and intercostal muscles relax, the chest cavity volume decreases, and the pressure inside the lungs increases, forcing air out. During forced expiration, example exercise, coughing, abdominal and other chest muscles actively contract. Gas exchange. Oxygen diffuses from the alveoli into the blood, specifically, into red blood cells where it binds to hemoglobin. Carbon dioxide diffuses from the blood into the alveoli to be exhaled. Ventilation. Perfusion matching, V/Q. For efficient gas exchange, the amount of air reaching the alveoli, ventilation, needs to be matched to the amount of blood flowing through the capillaries surrounding those alveoli, perfusion. Imbalances in V/Q can lead to breathing difficulties. Control of breathing. The respiratory center in the brainstem, medulla and pons, controls the rate and depth of breathing. Chemoreceptors in the brain and blood vessels monitor levels of oxygen, carbon dioxide, and pH. Changes in these levels trigger adjustments in breathing to maintain homeostasis. 2. Defining breathing difficulties, dyspnea. Dyspnea is the subjective experience of breathing discomfort. It's a symptom, not a disease. It's often described as shortness of breath, air hunger, tightness in the chest, feeling like you can't get enough air, increased effort to breathe. 3. Common causes of breathing difficulties. Dyspnea has a wide range of potential causes, spanning from relatively benign to life-threatening. Pulmonary causes, related to the lungs. Asthma. Chronic inflammatory airway disease characterized by reversible airflow obstruction, bronchial hyperreactivity, and inflammation. Symptoms include wheezing, coughing, chest tightness, and shortness of breath. Asterisk chronic obstructive pulmonary disease, COPD, a group of lung diseases, primarily emphysema and chronic bronchitis, that cause airflow obstruction. Smoking is the leading cause. Symptoms include chronic cough, sputum production, and shortness of breath. Asterisk pneumonia, asterisk infection of the lungs causing inflammation of the alveoli, which fill with fluid or pus. Asterisk pulmonary embolism, PE, a blood clot that travels to the lungs and blocks an artery. Asterisk pneumothorax, asterisk air leaking into the space between the lung and the chest wall, pleural space, causing the lung to collapse. Asterisk pulmonary edema, asterisk fluid accumulation in the lungs, often due to heart failure, cardiogenic pulmonary edema. Asterisk interstitial lung diseases, ILDs, a group of disorders that cause inflammation and scarring of the lung tissue. Asterisk lung cancer, asterisk tumors in the lungs can obstruct airways or damage lung tissue. Asterisk cardiac causes, related to the heart. Asterisk heart failure, asterisk the heart is unable to pump enough blood to meet the body's needs, leading to fluid buildup in the lungs, pulmonary edema. Asterisk coronary artery disease, CAD, reduced blood flow to the heart muscle can cause angina, chest pain, and shortness of breath, especially during exertion. Asterisk arrhythmias, asterisk irregular heart rhythms can reduce the heart's ability to pump effectively. Asterisk pericardial effusion / tamponade, asterisk fluid accumulation around the heart can compress it and impair its function. Asterisk other medical conditions, asterisk anemia, asterisk low red blood cell count, reducing oxygen carrying capacity. Asterisk obesity, asterisk excess weight can strain the respiratory system. Asterisk anxiety and panic disorders, asterisk can cause hyperventilation and feelings of shortness of breath. Asterisk neuromuscular disorders, asterisk conditions like muscular dystrophy or amyotrophic lateral sclerosis, ALS, can weaken respiratory muscles. Asterisk metabolic acidosis, asterisk acid buildup in the blood, triggering increased respiratory rate to blow off carbon dioxide. Asterisk sepsis, asterisk severe infection that can lead to respiratory distress. Asterisk allergic reactions, anaphylaxis, severe allergic reactions can cause airway swelling and breathing difficulties. Asterisk environmental factors, asterisk high altitude, asterisk lower oxygen levels at high altitudes can cause shortness of breath. Asterisk air pollution, asterisk exposure to pollutants can irritate the airways. Asterisk exposure to irritants / toxins, asterisk inhaling smoke, chemicals, or other irritants. 4. Diagnosis of breathing difficulties. A thorough evaluation is crucial to determine the cause of dyspnea. The diagnosis process typically involves asterisk history and physical examination, asterisk detailed medical history, asterisk symptoms, onset, duration, severity, triggers, past medical history, asthma, COPD, heart disease, medications, allergies, smoking history, occupational exposures. Asterisk physical exam, asterisk assessing vital signs, heart rate, respiratory rate, blood pressure, oxygen saturation, listening to lung sounds, wheezes, crackles, decreased breath sounds, checking for signs of heart failure, edema, jugular venous distension, examining the chest and abdomen. Asterisk diagnostic tests, asterisk pulse oximetry, asterisk measures oxygen saturation in the blood. Asterisk arterial blood gas, ABG, measures the levels of oxygen, carbon dioxide, and pH in arterial blood. Provides a more comprehensive assessment of respiratory function than pulse oximetry. Asterisk chest X-ray, asterisk provides an image of the lungs and heart to identify pneumonia, pulmonary edema, pneumothorax, lung masses, or other abnormalities. Asterisk electrocardiogram, ECG/EKG records the electrical activity of the heart to detect arrhythmias or evidence of heart damage. Asterisk pulmonary function tests, PFTs measure lung volumes, airflow rates, and gas exchange. Used to diagnose and assess the severity of asthma, COPD, and other lung diseases. Asterisk complete blood count, CBC checks for anemia or infection. Asterisk brain natriuretic peptide, BNP blood test to help diagnose heart failure. Asterisk D-dimer asterisk blood test to rule out pulmonary embolism, PE. If elevated, further testing, CT angiogram of the chest, is usually needed. Asterisk CT scan of the chest asterisk more detailed imaging of the lungs than chest X-ray. Can detect pulmonary embolism, lung masses, interstitial lung diseases, and other abnormalities. Asterisk echocardiogram asterisk ultrasound of the heart to assess heart function and structure. Asterisk bronchoscopy asterisk a procedure where a flexible tube with a camera is inserted into the airways to visualize them and obtain samples for analysis. V. Management of breathing difficulties. Treatment depends on the underlying cause. Asterisk immediate measures, acute dyspnea. Asterisk oxygen therapy asterisk supplemental oxygen to increase oxygen saturation. Asterisk bronchodilators asterisk medications, example albuterol, that relax the muscles around the airways to open them up, used for asthma and COPD. Asterisk corticosteroids asterisk anti-inflammatory medications, example prednisone, to reduce airway inflammation, used for asthma and COPD. Asterisk diuretics asterisk medications, example furosemide, that help remove excess fluid from the body, used for pulmonary edema due to heart failure. Asterisk non-invasive ventilation, NIV using a mask to deliver positive pressure ventilation, example CPAP or BiPAP, to support breathing. Asterisk intubation and mechanical ventilation asterisk inserting a tube into the trachea and using a machine to breathe for the patient, for severe respiratory failure. Asterisk treatment of underlying cause asterisk antibiotics for pneumonia, anticoagulants for pulmonary embolism, etc. Asterisk long-term management, chronic dyspnea. Asterisk smoking cessation asterisk essential for COPD and other smoking-related lung diseases. Asterisk pulmonary rehabilitation asterisk exercise training, education, and support for patients with chronic lung diseases. Asterisk medications asterisk inhaled corticosteroids and long-acting bronchodilators for asthma and COPD. Asterisk oxygen therapy for chronic hypoxemia. Asterisk medications to manage heart failure. Asterisk treatment of underlying medical conditions, example anemia. Asterisk lifestyle modifications asterisk weight loss for obesity, avoiding triggers for asthma, managing anxiety. Asterisk palliative care asterisk for patients with advanced lung disease or other conditions causing chronic dyspnea, palliative care can focus on symptom management and improving quality of life. 6. Simulating breathing difficulties programmatically, conceptual and educational. Important disclaimer asterisk this code is for educational purposes only. It should never be used for medical diagnosis or treatment. Simulating physiological processes is complex, and this is a vastly simplified model. Always consult with a qualified medical professional for any health concerns. We can create a basic simulation of how certain factors might influence perceived breathing difficulty. This will be a very abstract and simplified representation. Key points about the code. 1. Respiratory model class asterisk represents the respiratory system with key parameters. 2. Init__ asterisk initializes the model with baseline values for ventilation, oxygen saturation, airway resistance, lung compliance, blood oxygen capacity and anxiety level. 3. Calculate _dyspnea score asterisk. This is a very simplified function that calculates a dyspnea score based on the model's parameters. Higher scores indicate greater perceived breathing difficulty. The formula is arbitrary and designed for illustrative purposes only. 4. Simulate asthma attack asterisk simulates an asthma attack by increasing airway resistance. 5. Simulate exercise asterisk simulates exercise by increasing ventilation. 6. Visualization asterisk a plot shows how the airway resistance affect the dyspnea score. Important considerations for expanding the simulation asterisk. More realistic formulas the calculate dyspnea score function is extremely simplified. You could research and incorporate more realistic physiological relationships, example the effect of CO2 levels on ventilation, the oxygen hemoglobin dissociation curve. Time dependence model how breathing difficulties change over time. For example, how the body responds to hypoxia, low oxygen levels, or hypercapnia, high CO2 levels, over minutes or hours. Feedback loops implement feedback loops to simulate how the body attempts to compensate for breathing difficulties, example increasing ventilation when oxygen saturation is low. Patient-specific parameters allow the user to input patient-specific parameters, age, weight, pre-existing conditions, to make the simulation more personalized. Stochasticity add random variations to simulate the natural variability in respiratory physiology. 7. Conclusion. Breathing difficulties are a complex symptom with numerous potential causes. A thorough medical evaluation is essential for accurate diagnosis and appropriate management. The code example provided is a very simplified illustration for educational purposes and should never be used for medical purposes. I hope this in-depth tutorial is helpful. Remember, if you or someone you know is experiencing breathing difficulties, seek immediate medical attention.